My name is Lauren Stanley, and today I'm going to be showing you guys how to do a subcutaneous injection. So first, my order is for 5 units of regular insulin. It's a one-time dose. So before I begin, I'm going to check my patient's blood sugar and just verify that it is above average for my patient. So I wouldn't administer insulin if it was low. So I'm going to check the MAR before I do anything. So I'm going to verify that it is the right patient, the right drug, the right dose, the right route, and the right frequency. So after I check the MAR, I'm going to go ahead and go to the med room. I'm going to make sure that this is regular insulin. And I'm going to make sure that my syringe is a 1 milliliter syringe. It's a 28 gauge and it's a 3/8 needle. So after I verify all that, I'm going to perform hand hygiene. And I'm going to put on gloves. So after I do that, I'm going to get an alcohol pad, and I'm just going to wipe the top of the vial. After I do that, and while it's drying, I'm just going to go ahead and open up my needle. After that, I'm going to uncap it, and I'm going to draw up 5 units of air. Just make sure that's correct. I'm going to go ahead and inject it into the vial and push the air in. After that, I'm going to pull up 5 units. I'm just going to go ahead and get the bubbles out. Make sure that is the correct amount. Okay, so now after that, I'm going to cap the needle. And I'm going to go ahead and go to the patient's room. I'm going to dispose of these gloves. When I get to the patient's room, I'm just going to go ahead and check the MAR again for the 5 rights, the right patient, the right drug, dose, route, and time. After I've checked that, I'm going to go ahead and assess my patient's skin. I'm just going to make sure that there is no edemas, bruising, rashes, breaks in skin, anything like that. So I'm going to go ahead and perform hand hygiene again and put on a new pair of gloves. After that, I'm going to get an alcohol pad, and I'm going to clean my patient's skin from the innermost part to the outermost part. After that, I'm going to dispose of that. I'm just going to check my needle again that this is the correct amount of insulin, and uncap my needle. So this is an average patient. Since this is a 3/8 needle, I'm just going to go ahead and pinch the skin and inject at a 90-degree angle. If this were an obese patient, I would pull the skin taut and inject at a 90-degree angle. If it were an average patient and I had a 5/8 needle, I would pinch the skin and inject at a 5/8. If I had a 5/8 needle, I would inject at a 45-degree. But since this is an average patient and a 3/8 needle, I'm just going to go ahead and pinch the skin and inject at a 90-degree angle. And I'm just going to hold that for a few seconds. So after that, I'm going to pull it out and release the skin a little bit. I'm going to cap the needle. If this were in a clinical setting, I would put the safety cap on, but since we're not in a clinical setting, I'm just going to put the regular cap back on. And I'm going to dispose of this in the sharps container. I'm going to assess the skin once again, make sure that there is no adverse reactions or bleeding. If there is any bleeding, I'm just going to go ahead and dab it with a cotton ball, or if there's a lot of bleeding, I'm going to hold the cotton ball and bandage the skin. But there are no adverse reactions, so that is how you do a subcutaneous injection.